remedy is ALumina. The central thread of ALumina is slowness. Slowness of functions eventually leads to paralysis. There is delayed action both internally on mental plan and externally on central and peripheral nervous system. There is slow onset and the patient doesn't realize for a long time that there is something wrong with him. A feeling of heaviness in legs for which he doesn't complain until it is developed into locomotor ataxia. ALumina takes hold of mind and he is not able to comprehend the things, doesn't figure out how to proceed, how to accomplish the things, the task he has undertaken, cannot decide, decision making difficulties there, and this leads to the confusion of mind. This confusion progresses to another peculiar state that her judgment is disturbed. He is unable to realize what is real or not. He is unable to realize who he is. He doesn't know what is real, what is not. In chronic diseases, we have the best expression of this state. He says, when he says something, he feels as if someone else is saying. When he sees something, as if someone else is seeing. Or he feels that he could see if he is transferred to another body. There is great confusion of mind and the continuity of thoughts is also lost. He finds it very difficult to express his inner state. He chooses wrong words, chooses this, that, make much effort and pause for a long time. Train of thoughts is lost and there is confusion of mind. So much confusion that he uses so many wrong words and phrases to express his inner state. Then he enters into another state. He gets into hurry, time passes too slow and everything is delayed. An hour seems half a day to him. Beside this, he gets impulses on seeing sharp instruments and blood. He gets the impulses of killing himself and then he shudders. Then the patient meditates and he realizes that he is going to be insane. And this is not the fear of insanity, but this is the actual conclusion. And if you feel there is fear of insanity, then ALumina is ruled out. It is not indicated in fear of insanity. Finally, patient falls into a state of despair. In arsenic, there is also despair state, but it is full of fears and fear of death is very much marked. But here, nobody can help him. Why he is not getting better? In ALumina, there is deep despair with confusion of mind, and this can be the early symptom of schizophrenia. This progress from slowness of mind to confusion of mind, loss of identity, and despair of recovery, and finally there is degeneration of nervous system, whether by age or by frequent diseases. The sense of being hurried leads to apprehension. When she realizes that she is so slow that she is not able to finish the task which she is doing, and this Slowness leads to apprehension, and this realization that she is not able to finish her task in time, so this leads to apprehension. And then there is fear of unknown, fear that something bad will happen, or accident, or some misfortune. The most striking feature of ALumina is ALumina acts upon the nerves that proceed from the spine, and there is weakness of muscles supplied by these nerves, and there is weakness of whole body. Difficulty in raising arms, there is difficulty in swallowing, a paralytic weakness in esophagus, and a bolus is passed down with great effort, and she feels it all the way. And there is paralysis of one side, paralytic condition of bladder is there, and slow urine dribbles, and she has to wait a long time to start the urine. And there is paralytic condition of rectum. She feels that rectum is full and distended, and there is enormous quantity of feces, and she has not gone to stool for many days, and she feels it as if she will pass a stool, but there is inactivity, a paralytic condition of rectum. She sits for a long time and strains for the stool, continuously sitting, straining with sweating and all that, and she is unable to pass the stool. In ALumina there is a constipation for hard stool, but if there is paralytic condition of rectum, even the constipation with soft stool will be cured by ALumina. But if mental symptoms agrees, ALumina is a remedy full of vertigo. Objects move in circle continuously, vertigo of old broken down constitutions in spinal affections. All the symptoms are aggravated in the morning on waking. As you see in children wake up in bewildered state, as we have already studied while studying Aeschylus, and this state is in ALumina, Aeschylus and in Lycopodium, that the patient wakes up with confusion of mind. There are catarrhal states and headache. Whenever the patient takes cold, suffers from headache, may be due to the catarrhal states. ALumina patient suffers from dryness of mucous membranes. Nose is dry and there is stuffing up of nose, especially the left nose, and there is headache during the catarrh. Patient who is suffering from chronic catarrh, whenever he is exposed to cold wind, the yellow thick chronic catarrhal discharge will be slacked up and will be replaced by the watery running discharge from the nose, and this will be associated with headache, forehead pain, and which is ameliorated by lying down. There is disturbance of vision with catarrhal discharges from eyes as well as nose, and patient sees as through the fog, as through the mist, and there is weakness of muscles of ball and ciliary muscles, and there is variable vision. Sometimes it is better and sometimes it is dim. It is due to the muscular weakness of eye muscles. The patient is subject to all kinds of skin eruptions. There is indurations, crusty eruptions, dryness, and even there is itching without eruptions. And whenever the patient gets warm, itching aggravates. And if you see the patient, you will realize that there is itching and he scratches it until it is raw and then the crust is formed. There is first itching without eruptions and crust is formed after scratching, and he is better when the part is raw. In Mesothelium, arsenic, dolichos and alumina, there is first itching, patient scratches it and the skin bleed and is raw, and then the patient feels relief. It is very deep acting medicine. It is not for acute kind of colds, but it is like silicia, graphitis and sulfur. Alumina is similar to plumbum and curare in weakness of hands and finger. The person who play piano feels after some time that fingers are not lifting motion is lost, and for these conditions curare is a good remedy because curare acts upon the extensor muscles. Curare quickly relieves the lifting motion of the hand. Alumina is aggravated from starch, especially eating potatoes. There is lot of flatulence, distension, diarrhea after eating potatoes. Alumina patient has craving for indigestible things like chalk, mud, slate pencil, coffee, white rags, dry rice, pencils, etc. And he is aversion to meat and desire fruits and vegetables except potatoes, which aggravates. In males, there is weakness of sexual organs after overuse, and in females it is remedy of anemia, chlorosis in young girls, and there is lot of problems in females. There is leukorrhea, so copious, running down to heels. It is yellow or it is white of egg. There is always exhaustion after menses, and it is a very good remedy in menopause phase when the menses are scanty, but the patient is so exhausted during menses that she takes many days to recover this weakness. Leukorrhea is acrid, profuse, yellow or white of egg, and so profuse, running down to heels and makes the part raw. There is dragging down sensation from relaxed ligaments. Constipation during pregnancy is also a marked feature. Constipation in infants, when we see no other symptom is there, then alumina is given and it cures. Another most marked symptom is cough and chest. Cough of alumina is usually dry and existed since so many years. It is so chronic, dry, hacking cough. Here it competes with Argentum metallicum, but in Argentum metallicum there is dry, hacking cough only during the daytime, whereas in alumina it is early morning aggravation. Patient has long attacks of cough in the morning and he loses the breath, urine is passed, and there is sensation of hanging something in throat as if uvula is elongated, or a loose skin in the throat which excites the cough. We would think of alumina in singers when the voice becomes weak and feeble after overuse or paralytic conditions of the vocal cord. Earlier, Argentum metallicum was used in singers for trembling of the voice. Till the value of ALumina was not known. Many singers after taking cold feels the weakness of voice in the beginning. On beginning to sing, they feel weakness of voice, but after using it, it improves. And for such cases, Rustox is the medicine. This is a kind of hoarseness, not a weakness like argentum, metallicum and ALumina. There are some people who has to get rid of the mucus in the beginning. They feel as if their vocal cord is covered with mucus, so they clear up mucus and then they start using their voice. And for them, phosphorus is a remedy. In such cases, larynx is very painful. Vocal cord is very painful after use. The next most striking feature of this remedy is on back and spine. In myelitis, it acts wonderfully. Where there is considerable spasmodic conditions of back and there is a hoop-like sensation, tight bandage feeling around the limbs, around body parts. There are burning places as if a hot iron rod is forced in the spine, and there is paralytic weakness, one-sided weakness or complete paralysis. Running through the remedy, there is lack of vital animal heat. He is cold, chilly, he wears warm clothing, yet he wants open air. He goes to bed cold as frog, and after he gets warmth in bed and itching starts. He finds no comfort anywhere. He is cold, he gets warm, and warmth aggravates itching. A striking feature of this remedy is chronic dryness of skin. Sweat is rare and scanty. It is not a remedy of copious sweat like Calcarea carb, but a remedy for tired out from exertion, worn out, exhaustive, weak people. It is a remedy for spinal and paralytic affections. If we sum up ALumina, we have to see certain things. We have to observe in patient slowness, delayed action on all plans, along with weakness, exhaustion, overtired, worn out conditions, constipation, anemia in young girls, leucorias in young girls will be cured if you find totality of the ALumina symptoms like cravings and aversions. There was a patient I have seen few days back. A young girl came to me with leucoria complaint and has a strong desire to eat dry rice. Then I prescribed ALumina 200 and she responded very well. And one more case, there was a case of an old lady of 75 years old and she was not passing stool since 7 days and enemas were given. She was finally hospitalized and after 3 days they called me and I prescribed ALumina 200 and within 6 hours the lady passed enormous quantity of stool and was discharged from the hospital. Such is the wonderful effect. Where there is inactivity of rectum, paralytic weakness of the organs, ALumina acts wonderful. If a patient comes with difficulty in swallowing, see the patient as a whole, that how he is responding to you, how he is responding to your questions. If he is slow to react, there is difficulty in finding words and feels confused, then ALumina is the remedy. Prescribe for the totality of the symptoms, not for particular symptom. That is the secret of success. With this, enough. Good day.